Real quick takeaway from each one of you. We'll just go on down the line here, starting with Yonatan.
So again, I'd emphasize the importance of getting vaccinated and also the importance of continuing to invest in efforts to improve the vaccine through both the study of the virus and the study of the immune response to the virus and to the vaccine.
You know, I think a lot of young, healthy people say, well, the flu is no big deal for me, but I think they need to think about where the vulnerable people with underlying conditions, who we really want to vaccinate, but where do they acquire their infection frequently is from caregivers. And if there's an infant in the family, I think, people should be thinking about not getting the flu, not only because they don't want to get sick, but also because of the potential for exposure.
I would echo both of those and just add the sort of global perspective that we are in a incredibly well-connected world in which infectious disease anywhere can become infectious disease anywhere else by one plane ride. And it's more important than ever right now in a time of falling budgets to reverse that fall for the most important aspects of global health, which are not just other focused and beneficial to the world, but the U.S. is a leader for a reason, or the U.S. has been a leader for a reason in that area, and that's because it benefits us to have a robust network around the world of laboratories and scientists and epidemiologists studying these things, and to cut that at this point I think is a really catastrophically foolish decision.
And on to you, Tim.
I would agree with all of what's been said so far, and clearly we need better surveillance, I think, both in the U.S. and worldwide. I think that better understanding of what viruses are circulating and better predictive capacities for vaccine strain selection, this will contribute to improvements in public health. I think we need to understand what happened this season better, and particularly look at better ways to estimate vaccine or monitor vaccine effectiveness. And one thing we haven't talked about, actually the focus has really been on vaccines, but I want to just say a word about therapeutics. And so a lot of people get sick, millions of people get sick, hundreds of thousands of people get hospitalized, people die in this country. And so there's a real need for better and new therapeutics to treat influenza illness, and in particular to treat severe influenza illness, people who are hospitalized. And right now we're really focused on one class of antiviral drugs, but we really need to look at other modalities, combination treatment, and other therapies, including host-directed therapies. So I think there's really a lot of need for more developments for treating the patient better.